Jennifer, what do you think? Ready to get started?
Yeah, if you're ready to go, it looks like we have a healthy crowd here. So yeah, let's kick things off.
Absolutely fabulous. All right. Well, hello, everyone. Welcome. Thank you so much for joining us. I'm Carla Chugani. I'm here with Jennifer Davidson, and we are delighted to be talking with you today about Upstream Solutions. We'll be talking specifically about some different innovative, proactive strategies for supporting mental wellness on college and university campuses. So before we dive into the content, we want to just give a little bit of background on who we are. As I said, I'm Carla Chugani. I use she and they pronouns, and I am Vice President of Clinical Programs at Mantra Health. And Mantra is a digital mental health provider that offers a spectrum of products and services that are tailored for college students. Quick background on me. I'm actually a student affairs girl at heart. I'm a clinician, started my career as a clinician in a college counseling center, and then just, kind of fell in love with science, went back to school, and was very lucky to do research and then to join Mantra, doing the work that I do to support collegiate mental health at scale. And I'm thrilled to be here today with my colleague, Jennifer Davidson from Togetherall. So I'd like to hand it over to her to introduce herself.
Yeah, thanks so much for that, Carla. As Carla shared, my name is Jennifer Davidson, and I'm pleased to be here representing Togetherall and certainly our partnership with Mantra. For those who are not aware of Togetherall, we offer a digitally delivered population-level based peer support intervention. And despite the depth and breadth of the thinking and the evolution of Togetherall over the past 16 years, at the heart of what we do is a very simple idea. Togetherall is a community where people help people. And just to give you a sense of my background, I've now been with Togetherall for approximately 2 years. My role is the Vice President of Partnership Development. And I have spent the better part of my career at the intersection of sort of technology and population level services to support student success and addressing some of their basic needs around campus. And so I'm pleased to be here, and I'm excited about doing this work with you all. We'll be sharing greater details around our services later, but for now, I'll turn it back over to you, Carla, to kick us off.
Absolutely. So in the first part of the presentation today, we're going to be discussing several upstream services that can potentially be an impactful part of the mental health solution on campus. Before we get into the discussion, I'm just curious to learn a little bit more from you all about which of these services you think has the most potential to better meet the needs of your students. So I'm just going to open up a quick poll, if you wouldn't mind chiming in and letting us know when we think about different upstream services, content, coaching, peer-to-peer support, on-demand emotional support, urgent care style appointments, or something else. What are you gravitating towards specifically in terms of something that could really be like, if we had to choose one, this would be the thing that we would choose because we think it's going to really have a big impact on our campus? All right, so I will share these with you. I'm gonna wait. We have fabulous participation in this poll. Thank you so much.
Great.
Thank you so much. And so I'm just going to give it another minute. Let's see. Really interesting results here. So I'm going to go ahead. I'm going to close this and share it with you all so you can see. So it looks like it looks to me like, everyone is seeing some value in the things that are on this list, but it seems that mental health coaching and on-demand emotional support are kind of in the lead as things that could potentially have a lot of impact. And very close behind this, we have peer-to-peer support and urgent care style mental health appointments. Unfortunately, the chat does not appear to be working today. We do have a Q&A open though. So if anyone does have a question or want to drop a comment about what's that something else that you feel like is needed, we should be able to see it if you use the Q&A function. All right, so let's get started. Here we have just a brief overview of what we'll cover today. I want to start by just thinking about what are upstream solutions. We'll talk a little bit about each of the different solutions that we think can be a real value add to your campuses. And of course, we'll have time for Q&A at the end. And I'm seeing some questions in the chat I'm just going to quickly respond to. How faculty can best help students would be a key resource. I will make sure to address that sort of throughout the presentation. There's also a request to define mental health coaching a little bit more, because there is, you're right, Janine, a lot of confusion around that terminology. We are definitely going to do that. And then we have a question about the importance of cultural awareness and culturally relevant approaches to therapeutic services. So to address that, I want to highlight that, upstream solutions typically don't include therapeutic services. But whether we are doing an upstream service or a clinical or therapeutic service, I think that cultural awareness, culturally relevant practices, as well as trauma-informed practices, should really just be foundational elements of any product or service that we're offering. So the first thing I want to start us off with today is just some discussion about what the core idea of upstream approaches are. So I think of an upstream approach to mental health as any type of health promotion or prevention service or intervention that's designed to be applied prior to the development of symptoms or need for clinical care. So that would be like therapy, psychiatry, intensive outpatient, those kinds of things. And upstream approaches are a really critical piece of public health approaches to mental health, both for economic and for human reasons. So on the financial side of things, it costs a lot less to prevent a problem from developing than it does to treat a problem. And this, as I'm sure you all know, is the concept behind a lot of the preventative health care that we, hopefully try to keep up with. So getting our teeth cleaned or getting our, I don't know, pap smears or whatever we're doing. And then on the human side, I think the human side, a lot of times we think about the economic side because the fiscal limitations can create real barriers to accessing care. But there's also this human side that's really important. So when we wait for problems to get really bad before we help someone, the human suffering that is experienced is also typically much greater. The downside to these upstream approaches, though, is that they rely on individuals to feel motivated to engage in mental health prevention and mental health maintenance, right? So if we go back to our health example, most of us probably don't get too stressed out if we miss a teeth cleaning every once in a while, as long as our little toothies are feeling fine, right? But if we have a really painful toothache, we're going to be very motivated to get to the dentist as soon as possible. So that pain, while it's very unpleasant, is also a thing that motivates us into taking action. It motivates behavior. And so because of this, I think it's very important that as we are thinking about some of the different types of upstream programming that we can offer to college students, we also need to be carefully considering how are we going to motivate students to actually use and engage with that programming. And to go back to Mark's question about how can faculty actually help, I am a former faculty member at the University of Pittsburgh, and one of the things that I think that is very important that faculty can do is to use the tools and resources and power and influence that they have to get this information out to students, right? So all these different, the university typically can't require, or often, is very hesitant to require putting information on a syllabus because it could interfere with, academic freedom or things like that. But you as a faculty member can choose to put all these different mental health, basic needs, all kinds of different resources on your syllabus. You can program it into the homepage of your LMS, and you can use the different tools that are available as part of the educational experience, right? So in a little bit, I'll talk about some of Mantra's wellness content. And one of the fantasies I have is that faculty just have students take one of our, stress relief modules, maybe the week before finals, and give a point of extra credit for completing that, or, something like that. So I think there's a lot of ways that faculty can get the information to students and help be a motivator for students to complete and sort of at least sign up, engage, explore the different tools and resources that are available related to mental health. So we are going to be talking about 4 different types of upstream solutions today. That will include content, coaching, walk-in and single session interventions, as well as peer-to-peer support. And Jennifer, I wanted to ask before we jump in if you want to add any additional thoughts here.
Yeah, I would just add this context, Carla, that over the past decade, we've seen major shifts on how we think about mental health challenges. Certainly, we've seen that particular shift over the past 3 years, and many of those who are on this webinar today have been part of those shifts, from reducing stigma to early interventions. And given this effort and the number of and sort of extreme amount of societal challenges that are facing our students and communities, there's obviously no surprise that the demand for support is greater than ever. But I think that meeting that demand isn't just doing more of the same, but rather really thinking about how we can reduce barriers to accessing support, including engaging faculty as part of that solution, and really being able to attend to the full range of mental health challenges that our students are facing, and then thinking about that in the context of delivering population-based solutions that creates equity and access, because population-based solutions allow everyone to be able to benefit from them. So, and I think over the course of the next several slides, we're going to be talking about what those solutions tend to be, and then we're going to be talking a little bit more about the specific services. So I'll turn it back over to you, Carla, to kick us off.
Yeah, thank you so much. All right. So when it comes to wellness and mental health content, there's a lot of material out there to choose from, right? And I like to think of most content as falling into 2 categories. So we have our psychoeducational content and then our socio-emotional learning content. And of course, there's lots of content on the internet. There's lots of content on social media. There's videos, there's quick tips type articles. And, the value of these probably falls on a spectrum. But the 2 approaches that we have on this slide, I think, are the 2 that are most commonly included in upstream strategies for mental health promotion. So I think of psychoeducation as tending to be much more focused on knowledge building, whereas socio-emotional learning is going to include some knowledge building, but also a healthy focus on skill building and practice. When we think about psychoeducation, it is content that should absolutely be drawn from the literature. It should be evidence-based, and it should provide our students with honest, accurate information about the topic. So psychoeducation can actually be, sounds simple. It can be really helpful for reducing common misconceptions and stigma around mental illness. And the hope is that through education, we're going to be increasing a student's knowledge about mental health and illness, including what to do and how to seek help should they ever need it. We also have what are called gatekeeper programs that I feel like they kind of fall somewhere between psychoeducation and SEL, right? There's some combination of knowledge and skills specifically around how to recognize warning signs that someone might be at risk, respond to that person in the moment, and get them referred to an appropriate resource. And some of the most popular gatekeeper programs that are used on college campuses include a program called Mental Health First Aid. There's another wonderful program called QPR, and that stands for Question, Persuade, and Refer. So these types of programs do help students learn a little bit about mental illness and mental health, although the focus is usually on how to recognize when somebody else is struggling and how to respond to them and help them in an appropriate way. And then we have socio-emotional learning content, and that's usually a little bit more in-depth type of a program that focuses on building deeper knowledge and practical skills in a particular area. We a lot of times see these programs in middle and high schools, but there has actually been a movement towards doing it in college as well, particularly within college coursework, which I think makes good sense because when there's a grade attached to it, there's just more motivation to engage. I've done work like this at the University of Pittsburgh, but I think the most widely publicized example of this would be Yale's has a course that's called The Science of Well-Being. It was one of the most popular courses in the school's history. SEL programs can focus on a lot of different things. It can be mental health or suicide prevention. It can also be relationships, social skills, or decision making. There can be a lot of different topics to cover. Mental health and wellness coaching is also becoming an increasingly popular upstream solution, particularly in terms of its ability to support individuals in working on health and wellness related goals that are linked to the prevention of chronic disease or chronic difficulties. So, for example, reducing and managing stress has incredible both mental health and physiological health benefits. Coaching can also provide access to mental health support at a much lower cost relative to interventions like therapy or psychiatry. And coaching might also not come with the same stigma for some folks as they might experience if they were trying to participate in therapy or psychiatry. It is very important to understand, though, that coaching is different from therapy, and it's not a therapy light type of thing. It is really a qualitatively different service. So, between coaching and therapy, both professions do share a focus on identifying and supporting a client in working toward meaningful goals. Therapists, however, diagnose and treat mental illness. They also provide assistance in working through extremely challenging life experiences and issues, including, maybe stuff that's happened in the past, trauma, things like that. Coaches do not diagnose and they do not provide clinical care. They are much more present and future oriented. The focus with coaching is really on listening to that individual and helping them work on self-improvement in whatever way is feeling meaningful to them. And although coaches are not clinicians, for safety reasons, just simply for safety as well as the well-being of the clients that they serve, they definitely should be trained to recognize warning signs and times when a person who's participating in coaching is probably a better fit for clinical care and being willing to make those referrals. And I have to admit, I was skeptical of mental health coaching programs for a long time. I'm a clinician, and I really didn't understand the value that this profession can bring. But I am also a scientist, and so I reserve the right to change my opinion when I'm presented with compelling data. And the research on coaching is pretty clear. It's not just any old coaching, right? But well-designed longitudinal coaching programs that incorporate evidence-based practices typically show very good outcomes and show very good return on investment. So very good cost effectiveness relative to the outcomes that the people in the program demonstrate. And so for these reasons, I think we're going to see coaching really continuing to grow as it's a part of this upstream constellation of solutions in the years to come. I also want to mention walk-in appointments and single session interventions. I know that these don't sound like upstream approaches just at the surface, because especially when it comes to a walk-in appointment or more urgent care style service, the person using the service is likely to already be, more acutely distressed. But I think that these types of single session and on-demand supports can be a really valuable part of an upstream approach, because here we're focusing on trying to get upstream of a full-blown crisis. So sometimes if we just give someone quick, easy access to some support and some guidance right in that critical moment, we can help them just resolve that challenge right then and there, or get them feeling comfortable that they know what they need to do next and they have a plan to do it, as opposed to maybe waiting to access therapy and waiting for that intake appointment either days or weeks later. So again, you can see that this is both more an economical approach as well as one that really hits on reducing human suffering. I'm not going to focus a ton on single session interventions today, but I just wanted to give a nod to them because it's something that's really exciting and up and coming in the field. So single session interventions are actually single session therapy appointments, and there's some really exciting research being done on these right now, particularly by a scientist named Jessica Schleider. She's at Northwestern University. And I think that because these are so cost effective and they are showing nice clinical outcomes, we are going to continue to see these types of developments popping up as a way to keep the costs down while boosting access to evidence-based mental health interventions over the next several years.
It would help if I took myself off mute. Thanks so much, Carla. Really interesting opportunity to learn a little bit more about the various upstream interventions that are becoming more available and increasing in their evidence base. I think what's really interesting about peer support is that everybody can relate to peer support. I'm sure there's not one person on this webinar today that has not experienced some peer support in some form of fashion over the course of their lives. Effectively, it is people coming together to share their lived experience and knowledge to give and receive help. It's certainly natural, it's humanistic, and what we've seen over the past several decades is that it's becoming more part of the healthcare mainstream. And the positive impact of peer support on mental health is widely established as well. If you think about the foundational element of peer support, it's the mutual exchange of emotional support. There are certainly benefits to the helper in giving support as much as there is in receiving support. And when individuals have an opportunity to experience reflected in others' experience, individuals certainly feel validated, their own experience is normalized. This provides for an opportunity for acceptance in themselves and others. The idea of lived experience also offers an opportunity to receive new and very helpful information, perhaps even drawing comparisons from others, and even seeing others as role models to potentially emulate and move towards action and change. And, when individuals see their experience reflected through the stories of others, it does allow for feelings of belonging, this idea of fitting in, or at the very least, no longer feeling othered in the world. And then lastly, I would say that peer support creates an opportunity for empowerment. We recognize that peer support aligns with preferences for autonomy and choices with a focus on those natural support systems. And so when we think about the delivery of peer support, we often and sometimes recognize that peer support is perhaps provided in an analog setting. But we're going to be talking a little bit later on about how we actually are able to digitize that experience and make it scalable. So for now, Carla, I'll turn it back over to you. I think what we wanted to share with the folks on the call before we dive into the specific services that we're here to talk about today is giving them a visual of how these services can be integrated in a continuum of care.
Yeah, absolutely. Thank you so much. So now that we've talked through sort of conceptually what the different upstream service models are, I want to show you how these can be integrated and how we're doing that at Mantra Health, as well as to have Jennifer share more about the tremendous work that they've been doing with Togetherall. So on this slide, you can see our whole campus care model, which is designed using the JED Foundation's comprehensive public health approach to supplement current counseling center offerings. And as you can see, all of the services that we just discussed fall into those health promotion and prevention categories. And of course, clinical care, crisis services, higher acuity care, those are all still very important. But in this model, we're just also doing much more to prevent students from needing those services in the first place. So I want to start with just a little bit of an introduction to our self-care content program. Our content program is a comprehensive library of skills from dialectical behavior therapy, or DBT. And DBT is my area of expertise, both clinically and in terms of my research, which has really largely been oriented around increasing equitable access to DBT for college students. DBT is an evidence-based cognitive behavioral therapy, and the skills that are part of DBT are really broadly useful for developing the ability to cope with and navigate life stressors, challenges, and just, the ups and downs of being alive, right? So our program is designed to promote positive mental health on a campus population level by being accessible to any student at any time they want to engage. And students have given us actually really wonderful and positive feedback about our self-care content. So as you can see on the slide, we have excellent ratings overall. As well as for the quality of the examples we use, skill comprehension, video quality, and topic relevance. I know that topic relevance doesn't entirely touch on cultural relevance, but I will say that one of the things that I have focused on very deeply in my work is to ensure that when I'm teaching these skills, I'm teaching them through the lens of an anti-racist framework, and with really an eye to just how diverse the current college student population is in so many ways, not just racially, ethnically, but also just in terms of the age range of people that are coming to school and non-traditional students, and really making sure that this content not only is going to be culturally relevant, but is going to be relevant to students sort of regardless of what phase of life they're in. So I know that we have a variety of folks on the call today, some clinical folks, some non-clinical folks. So I just want to give a little bit of an explanation about what DBT is, just for the folks that aren't already familiar with it. A lot of people think of DBT as an evidence-based treatment for individuals with borderline personality disorder or chronic suicidality, and that's what it's for. And it's in its full therapeutic glory. That is absolutely what DBT is for. But there has also been a progression in the field towards seeing DBT skills both as critical for helping those, in therapy with really severe dysregulation, as well as skills that can be just really helpful for functioning effectively in the world. And I see DBT skills as particularly a good fit for college students because they're really developmentally appropriate for supporting a successful transition to adulthood and navigating sort of unexpected stressors and challenges, which often occurs when you're engaged with higher education. Outside the therapeutic context, it's really about teaching folks to develop their self-awareness and their self-regulation. And students can browse the skills individually. We also have mini courses that are available organized around particular topics like stress reduction or communication and relationship skills. And then we also have a pathways quiz where students will take a little quiz and then they'll receive a personalized set of different DBT skills to work on based on their experiences and their goals. And for the clinicians in the room, I do want to highlight that the skills in our library cover all 4 of the core DBT modules. So mindfulness, emotion regulation, distress tolerance, and interpersonal effectiveness. So it's quite a comprehensive library of DBT skills, and the content itself is quite different from typical mental health content, which is more on the psychoeducational side of things. And then in terms of what this experience looks like, each skill is taught through a multimedia micro lesson. The lessons are typically between 5 and 8 minutes each, and there's this dynamic mix of text, images, examples that help give more context, brief videos, and journal reflections. And I actually shot all of the videos personally, and I knew from having done this as a faculty member that no one was going to want to watch Dr. Chugani lecture for an hour. This would not be the way. So each of these videos is about 90 seconds or less. The videos are really an opportunity for me to model how I apply the complexity of the skills to the complexity of a real life challenge. I also, in the videos, really lean into sharing some of my personal experiences because I'm sitting in the position of being an expert, and I want to show some vulnerability and fallibility to help remind students that everyone does have some of these experiences, and also help to destigmatize the experience of having mental illness. The journal reflections are a really useful opportunity for students to reflect on what they've learned in the lesson and start thinking about how it applies to their own life. And that's a really critical piece in helping them move from simply the knowledge building to being able to apply the skills. So that's this concept of moving from knowledge acquisition to behavioral generalization into the natural environment. That's where we move from simply knowing a thing intellectually to being able to do it. And then hopefully over time, being able to do it under distress, which is harder than being able to do the skill when we're in a good mood. All right. And next up, I'll be talking about coaching. I do like to think of our self-care content as kind of a foundation of all of our upstream programming at Mantra. Our coaching program is layered on top of our content because we know that these types of content programs are typically much better utilized when there is a human in the loop. And so even when content is very high quality, some students are just going to need a little bit more support and guidance to set and reach their goals. And so one of the ways that we can address this is by providing access to a professional emotional wellness coach. Our coaching program is time limited. It's about 8 to 12 weeks typically, and really grounded in supporting and empowering students to set and pursue their own goals related to emotional well-being. And again, the goal here is reaching more students upstream with the hope of preventing stressors and challenges from turning into symptoms. And, to go back again to the human versus financial considerations, right? This does also help us reserve provider capacity for those students who really do need therapy services. We do not want to prevent the students who feel like they need therapy from accessing it, right? Students do get to be the experts in their own lives. But one of the things we're trying to do here with all these different upstream offerings is just to provide more options for mental health support for your students so that therapy doesn't continue to just be like a default for everything, because those resources are expensive and they are limited. And I've been really pleased with the feedback students have given us so far about our coaching program as well. They're really satisfied with the program. They tell us they feel highly supported by their coach in working toward their goals. And our pilot data also are showing that the majority of students remain stable or improve across key mental health outcome measures. And I know that symptom stability does not sound very exciting from an outcomes perspective, but I think it's important to keep this contextualized within the health promotion and prevention framework, right? So in any population, we're going to have a group of people who are already doing pretty well. And the goal for them is maintenance, maintaining your wellness as you face new and different stressors. So when we do outcome measurement, we don't necessarily expect to see dramatic decreases in symptoms because those symptoms were never really there in a meaningful way in the first place. If they were, it wouldn't be an upstream approach. And the last thing I want to share with you before I hand the mic back over to Jennifer is our on-demand emotional support program. So one of the things we do incredibly well at Mantra is risk management. And one of the ways that we try to manage risk and catch more students upstream of a full-blown crisis is through our on-demand emotional support program. This is available 12 hours a day, 7 days a week during the hours where students are most likely to call in. And our staff offer video-based appointments with a 10-minute or less wait time. And these are staff that are trained to support students in coping with a variety of different issues that might be upsetting them. So it could be a relationship thing, academic thing, anxiety. We will help them get connected to care if that's what they need. But we are also within this program fully prepared to offer crisis intervention for a variety of different types of emergency situations. So not just suicidality, but also things like homicidality, threats on campus, those types of things. And we do collect information from students who request to use the service up front so that we can prioritize those with higher risk in the queue, as well as also ensuring that while students are waiting, we're surfacing campus-supported 24/7 crisis information just in case they need that information. So now I'll hand it back over to Jennifer to talk with us about Togetherall.
Carla, thanks so much. I think the picture that you've painted is a really interesting one, and you've been able sort of to draw the through line of the value of preventative and promotive services for mental health services. And I think about the role that Togetherall has. It's really about being able to deliver a community of support in a digital format that can scale and support students no matter where they are. And, we talked at the beginning about the benefits of a peer support community. But we didn't talk about some of those barriers that may prevent students from actually seeking a physical community or otherwise. I don't think I have to share much about students feeling isolated, withdrawing, particularly as we look at a post-COVID world. we certainly recognize that there's still stigma related to help-seeking behavior, particularly for key populations that we're looking to support. Access can be a barrier, requiring students to be at a physical location at a certain date and time may actually create challenges, particularly for those students that Carla mentioned earlier in terms of reaching students who may be less traditional, if you will. And then having actually students recognize that maybe the challenge that they're dealing really is a mental health concern. And I think some of the preventative work that Carla just shared around DBT could be very supportive in that process well. And then if we parallel this conversation against what we are actually seeing in other digital communities, we can see here, just to give you some context, that the numbers are astounding in terms of the usage of these communities. I don't know if you all have ever done this yourself, but if you haven't, I would give it a go. Go out to Instagram or Facebook and Google mental health supports or hashtag mental health, and you'll see the tremendous amount of engagement there. And so when you think about and you put on your institutional leadership hat from a mental health perspective, the question, is not should students actually be using these digital mental health communities. The fact of the matter is that every student is arriving on your campus and they're already involved in multiple digital peer communities, some of which are really not safe, none guarantee anonymity, and none are clinically moderated. So the question is really not should they be engaged in these communities, but rather should students be providing a healthy alternative that is aligned with the goals and the mission of the institution and the work around in the counseling center, and being able to provide a space where students can actually go to get good informed support from their community. So that is really where Togetherall comes in as a healthy alternative to these communities. If you can go ahead and move forward, Carla. So at a high level, Together offers a clinically moderated peer support community. And if you think about the context of accessibility, it's available 24/7. There's immediate access, or regardless of where the student is, whether they're on campus, in their residential hall, on their way to class, or otherwise, the service is going to be available to them. The service is mobile first, so regardless of the type of hardware, the service in the community is going to be available to them. And then when we think about the safety and ultimately, this is the approach that Togetherall takes, is really thinking about how that clinical moderation within the community can provide a safe space for students to be able to give and provide support. Part of that is being able to do that in an anonymous way. We've already recognized that it reduces stigma, it helps drive help-seeking behaviors. And as an institution, we would work with you all to be able to create bespoke escalation process in the event that we would escalate a member out of the community. It is, again, a mental health peer support community, so we're going to have those instances, but we have those processes in place to be able to ensure that the student gets to that direct intervention as needed. And the last piece that I would talk about is you think about the value of peer support in a digital format is to be able to create vibrancy within that community. So Togetherall now, over the course of the past 16 years, we now work with about 450 partner institutions across Great Britain, Canada, and the United States, and about 4.5 million students actually have access to Togetherall as a peer support community. And Carla, if you can go ahead and move forward. I would love to share a little bit about what we're actually seeing and the students that we're actually impacting. So as you can see here, the peer community is actually reaching a very distinct student population. In our data, time and time again, we see that the community is actually reaching students who identify as Black, Indigenous, persons of color. As a matter of fact, you can see here that the majority of our student population identifies that way. 8% identify as gender nonconforming. And interestingly enough, about 25% of students identify as 25 years of age or higher, all populations which have been historically underserved in more traditional services. And we also find that 60% of the students who are actually utilizing the community say that Togetherall is the only source of formal support, and a little over 1/3 are coming in with some experience with suicidal ideation. So we're really reaching the hard to reach communities, and particularly those that we're concerned about. And then the last thing that I will share is that about 60% of the community actually receives support directly from the community, from one another. But about 40% of students actually receive some level of support from our clinical team that are moderating and monitoring the community 24/7. And then less than 1% are actually escalated from the community back to direct intervention. And I think this stat in particular underscores why Togetherall only has licensed clinicians monitoring and moderating the community 24/7. They're coming into the community charged with providing support, but are doing it with the sort of the background, the education, and the ethics of a clinician. And so with that, I'll turn it back over to you, Carla, to talk about and to lead our Q&A.
Yeah, thank you so much. We actually do have some immediate follow-up questions for you, Jennifer.
Oh, super.
So there's two in the chat. I'll just do one and then the next.
Sure.
So does protocol still moderate Togetherall? If so, will they provide crisis intervention as needed per the university's own protocol during business hours?
Yeah, so that's a great question. So a point of clarification is that the clinical team who's moderating the community, the Togetherall community, are employees of Togetherall. So we actually have a pretty large team that does that work, obviously 24/7. The relationship that Togetherall has with protocol is when a member in the community needs to be escalated to direct intervention services. So if an institution has a relationship with protocol, the way that we manage that is that we actually place a call directly to protocol, and then protocol connects with the student to be able to provide that direct intervention. But ultimately, what I would share is that regardless of how an institution manages their crisis escalation process, we actually create a bespoke risk management plan that aligns with the particular institution, so we can follow their internal processes and manage the student effectively from that perspective.
Thank you so much, Jennifer. And another question, I don't know if you want to say any more. So that last question was really about the crisis intervention piece. And there's another question just asking you to talk a little bit more about the monitoring component.
Yeah, absolutely. So within the community, we use the undergirding technology to be able to sort of review all posts within the community. And then the clinical team, and they're actually called wall guides within the community, are charged with three very specific tasks. First is to be able to monitor and manage risk effectively. Second is to be able to create a sense of vibrancy within the community, connecting with members of the community based off of their identified need. And then third is to be able to signpost members to the community, potentially to external resources that are related to the institutions. So the undergirding technology will help identify students who may be at risk. We do this through identifying particular language. So certainly language like pills, suicide, guns, something that would normally stand out to anybody. But we also look at sort of more nuanced language. So if a community member post and all they say in their post is "I'm done," could mean a whole range of things. And so what happens is that our wall guides will proactively reach out to the community member and do a bit of assessment and understanding of what's happening with the student. 9 times out of 10, we can de-escalate the situation within the community, but of course we are prepared to escalate the member out of the community. And then the last thing that I would share is that the undergirding technology also helps us identify when members of the community have broken sort of, for example, anonymity. So if they identify themselves in some type of way, the technology that we have allows the clinicians to either sort of sort of remove a bit of the post, and then we connect with a member, remind them about the anonymity or others. So there's a variety of things that we can do that are in our control to help manage and shape the community more broadly.
Yeah, and I have to say, I'm such a fan of the work that you all do at Togetherall. I mean, I've been a fan of Dr. Benlocks. You're, of course,
Sure.
chief clinical officer for many years, but the more I learn about Togetherall, the more I'm just like, yeah, that's the way to do it. That's the way to do it.
We appreciate that, Carla. We think the same of you all.
Oh, thank you. A couple of more questions popping in. So I'll take this one, and then Jennifer, please feel free to add on. There's a question about whether or not we have experience with group work or workshops for well-being content on campus. I personally have experience with both of those things. We don't offer groups at Mantra Health, but in my previous life as a clinician on a college campus, I certainly did lots of groups. And personally found that snacks were the best way to get people to show up.
Food is always an
Yes,
incentive.
a good snack. And we do actually do workshops as part of the services that we offer at Mantra. And I think different campuses are sort of more or less interested in these for probably a variety of reasons, but we certainly do offer them. And again, I think the success of these workshops, it really depends a lot on how you implement them. Just relying on students to show up is not always the best way. But if it's something where it's a required part of freshman orientation or freshman seminar, I'm also aware that, for students who are part of Greek life, there's often a certain amount prevention programming that they are required to attend annually as part of their membership in those organizations. And so working with those organizations to make that an option that fulfills those requirements, any way that you can do something to increase the motivation and the reinforcing value of completing that activity for the student will tend to increase the attendance of your well-being workshop on campus. Jennifer, did you want to add anything there?
No, I'm just in complete concurrence with you.
Okay, perfect. Let's see. We have some questions about, okay, how do you increase engagement with on-demand and student-initiated resources? We find that students do not engage with these. Yes, Tim, that is true. And so for me, again, what it comes down to is really strong implementation and marketing and campus activation plan. And so you cannot just rely on students to self-motivate to use these things. We have to think about how can we meaningfully integrate these things into the campus experience. In terms of how we do that on the marketing side, so we don't just have a standard package of marketing materials that folks can use. Our team actually works with each university's communications and marketing teams to learn about how does information spread on this campus, which emails get opened most often, who are the student influencers, maybe president of student government, those kinds of things. And we come up with a plan for how we are going to push this information out and motivate students to use it. And then we also get engagement of our content by layering it in with other programs, right? So for example, our coaches, as part of the coaching experience, they are assigning that DBT skills content in the app to the student each week. And so we can also boost engagement with the self-serve material that way. I personally also have a fantasy that faculty are going to put these skills in their courses as extra credit, or maybe I think there's a really good option of trying to integrate a little bit with your high enrollment and general education courses. I think just depending on where the students are at your campus, that's where you start thinking and getting creative about how to push this information out to the students and provide some motivation for them to use it. How do you all handle that at Togetherall, Jennifer?
So I think what you just shared, demonstrates that we have to think about connecting with students, particularly as we're looking at population level services at a population level. So you have to think about where students are and meet them where they are. So if you think about the type of students that may be utilizing these services, you identified, students who belong to Greek organizations. Our data shows, again, that a large portion of the students who are using our students identify as Black, Indigenous, or persons of color. So where you might be able to reach those particular students. And then, if you think about students who are actually seeking resources but may not know which door they want to open, is being able to potentially sort of aggregate the services so they have a sense of the variety of services that are being offered to them as a student. And then the last piece, and I think you touched a bit on this, in particularly for our peer support community, we've had a lot of institutions have success when they integrate it into a course of treatment. So being able to utilize the peer community in practice,
Yep.
And not only sort of in a course of treatment, but sort of post treatment as well. So we've seen a lot of success across the board there as well.
Thank you so much. So we are coming right up to the top of the hour, and I do want to be mindful of time because I know we're all very busy. There are more questions that we unfortunately couldn't get to today, so please send us an email, partnerships@mantrahealth.com. Send us an email with your questions. Any questions for Jennifer, we will be delighted to send her way. And I just want to ask before we wrap that you please take our post-event survey when you receive it as well. We really appreciate you attending today. We really appreciate your feedback as well, because it does really help us improve our events and make them more useful for folks like you. So thank you so much again. Thank you so much to Jennifer, to Togetherall. This has just been fabulous, and what a lovely way to spend an afternoon together. So thanks very much, everyone, and we'll see you next time.
Thank you, everyone. Bye-bye.
Bye.